Good morning, ladies and gentlemen. First of all, I would like to apologize for being unable to speak in Hungarian language, but it's very complicated to try to do something like that. I will try to speak in as clear as possible English, and then you can follow my reflections. First of all, I would like to start saying that it's my honor and great pleasure to have been invited here today as a speaker for the Robert Barani Award ceremony established by the Edward Loran Research Network Secretariat for recognizing young researchers working in the field of science, held at the Hungarian Academy of Sciences headquarters in celebration of honoring the Hungarian Science Festival. First, I would like to thank Professor Miklós Moroz, President of the Governing Board of the Edward Loran Research Network, and Dr. Joseph Bokor, Vice President, and Dr. Victoria Esther Zalani, Secretary General. As a special thanks also to my dear friend, the Ambassador and former Consul General in Barcelona, Barnabas Kovacs, for giving me the opportunity to share my thoughts about science in this post-pandemic era with such a distinguished group of scientists and academicians, and also give me the opportunity to congratulate the awardees. Before I begin, I would like also like to thank Dr. Joseph Bokor and Mr. Gyula Sumegi and Mrs. Gabriela Verborsky for their thought attention in organizing my arrival and the planning of this trip. That has been wonderful until now. It's also a great pleasure to learn more about the name of one of the most respected and brilliant minds born in this beautiful country, Baron Roland von Eötvös, the preeminent Hungarian researcher and multidisciplinary scientist, physicist, geophysicist, and innovator of higher education. His work regarding gravitation, surface tension, and the invention of the torsion pendulum was in fact one of the most important inspirations for Albert Einstein, cited in his 1916 paper, The Foundation of the General Theory of Relativity, which provided him the role of becoming one of the most important scientists of all times. But Hungary has always been a role model for the world of science in the last couple of centuries. Hungary occupies the 25th highest ratio in the world in investment in science and ranks 32nd among the most innovative countries, as according to the Bloomberg Innovation Index, and ranks 35th in the Global Innovation Index in 2020. Before I begin, it's my obligation to recognize, as from someone who is coming from abroad, to remember some of the greatest Hungarian scientists of all time. As the list might become giant, and this is not the main point of my presentation, but with your permission, I would like to lead off my address on this temple of knowledge of where we are now and to recognize a distinct few. By the way, probably this is the most beautiful place that I ever speak in my life. Laszlo Biro was the inventor of the ballpoint pen. The telephone exchange was invented by Tivada Puskás. The helicopter by Oshaka Asvoth. The dynamo by Ányos Zsedik. And Dennis Gabor developed the early principle of a holographic theory while working on improvements to the resolution of the electron microscope, and I have no doubt that all have made our lives considerably easier. Also, in the last 2 centuries, a remarkable large number of Hungarian scientists have contributed to the development of various branches of natural sciences. This is reflected by the impressive number of Nobel laureates of Hungarian origin. Philip von Lenner was the first Hungarian-born Nobel Prize winner in physics. He conducted experiments on cathode rays and their properties. His results led to the discovery of electrons and X-rays. Robert Barani, who gives the name of the award, was a Nobel Prize in Physiology or Medicine in 1914 for his work on the physiology and pathology of the vestibular apparatus. Albert Szent-Györgyi, Nobel Prize in Physiology or Medicine in 1937 for his discoveries in connection with the biological combustion process with a special reference to vitamin C and the catalysis of fumaric acid. And also my dear friend and admired scientist originally born in Hungary, Avram Hershko, Nobel laureate in chemistry in 2004 for discovering the ubiquitin system, the system which carried out the selective degradation of many short-lived proteins in eukaryotic cells. Ladies and gentlemen, I request your kind permission also to share with you a more personal message. Today, specifically during this pandemic, hand washings plays a significant role in our personal hygiene. In fact, as a friend of mine said, I never thought that my hands would be taking in more alcohol than my liver. Hand washing itself only became part of our daily routine approximately 150 years ago, thanks in part to the groundbreaking discovery by the Hungarian physician Ignaz Philipp de Semmelweis, who was, believe me, my first hero in public health as a medical student. In 2019, on my first trip to Hungary, I was invited by Dr. Kovács and the Royal European Academy of Doctors, and he was the topic of my lecture. As most of you know, Semmelweis observed maternal mortality rates and noticed that the rate of puerperal fever was higher in cases when doctors and medical students examined patients in the maternity ward directly after performing an autopsy. In 1847, he introduced mandatory hand washing among doctors, nurses, and medical students at the Vienna General Hospital to prevent further cases of infection. By introducing this new regulation, Semmelweis managed to reduce the rate of fatal puerperal fever. Unfortunately, he suffered from the incomprehension and envy of his colleagues, and sadly, he fatally died before he was recognized as one of the most important scientists of the world at that time. Today, we will reflect on the pandemic, the science behind the pandemic, and the consequences linked to this unexpected and challenging situation. The content of this speech was prepared after a deep personal reflection, along with review of several documents. Amongst all of these, I'm grateful to a paper produced by my admired friend, Dr. Pierre Joliot-Curie, the grandson of Marie Sklodowska-Curie, who wrote about the current pressure on scientists to obtain immediate results. It was very inspirational, and most of my description about this topic refers to him. Another source of knowledge and inspiration was a book entitled Reflections on the Pandemic in the Future of the World, edited by the Turkish Academy of Science, which I strongly recommend and is available on their website. Let's start by reflecting about how a particle which is 900 times smaller than a single human hair has changed our lives, and about what lessons we ought to have learned and what are the things we need to be sure that never ever happen again. As Dr. Henry Kissinger says, the coronavirus pandemic will forever alter the world order, and also, quoting my dear friend Dr. Rosalía Arteaga, the former president of Ecuador, the acronym BCAC will from now on have one more meaning: before coronavirus, after coronavirus. The effects of the COVID-19 pandemic are agitating global socioeconomic structures. The impacts of COVID-19 are estimated to be astronomical in terms of the number of lives and jobs lost. Most countries all over the world are adopting from almost 2 years ago health and economic measures to contain the pandemic, as uncertainty looms over its real duration, as well as the real-life consequences affecting the population and on its productivity. The scientific innovation and business communities has been working frantically to support emergency responses and government actions. During this past couple of years, we were witness to real-time collaboration between scientists across the globe in a race to develop the production of vaccines and antiviral medications. The industrial sector was repurposing production process to produce health supplies on a large scale. Technologists, innovators, and startups were teaming up to provide solutions to the most pressing issues. The post-pandemic response has led to drastic public health changes and new ways of creating diagnosis and treatment. COVID-19 is a watershed moment. The pandemic exposed weakness in internal processes, reliance upon traditional methodologies, and leadership gaps. It demonstrated a valuable capacity to leverage innovative technologies for prioritizing patient safety, to rapidly implement creative ways of enabling healthcare providers to continue providing care, and a new framework for solving complex medical challenges. Studies were reinvented with a great appreciation of how to quickly to access electronic health records to aid virtual data access, a practice that accelerated with the pandemic. Meanwhile, there were companies that had assembled large clinical medical database, empowering physicians and accelerating patients' research. They teamed up with medical associations to assemble and activate those databases in regulatory-grade data platforms. As medical associations realized the power of data and collaboration, more joined in the effort to access these insights, which ignite the research for vaccines and treatments needed to allow life to resume after the pandemic's curve fluttered. Enrollment challenges were extensively mitigated throughout targeted outreach, and the burden of patient participation lifted through a protocol simplification. Disease-specific analytics applied to real-world clinical data enhanced evidence generation and reinvented the process known as Phase 3 and 4. If enough data could be generated from diseases modeling applications, there were opportunities for provisional approval to study more real-world populations using wearables and symptom trackers now broadly applied clinically. During the crucial and uncertain COVID-19 lockdown, life science companies were forced to adjust decision-making, applying technologies more broadly, acting decisively to shift resources or alter work schedules, and prioritizing programs, process, and people that mattered in getting treatment to patients. These large pharma companies working at the leading edge with resources to start the transformation. However, during the pandemic, 15 smaller, forward-thinking biotech companies united to provide purchasing power to adapt to what had already been created and then took it even further. It is no doubt that while unfortunate circumstances caused this shift, they allow us to see what the future of drug and vaccines development could be: agile in action, patient-centric in design, and outcome-driven. At the same time, we are only at the beginning of the most challenging part, which is how we will emerge out of this situation and return to a new normal. Next, I would like to discuss my thoughts about how science has saved life and how, thanks to investments and billions in funding, we are now able to, with precautions and permanent surveillance, to see the light at the end of the tunnel. The first lesson that we need to reflect on is one key factor. The government of any country cannot, by any reason, cut off funding dedicated to health. Health is our most precious value, and the preservation and improvement of the health of their citizens should be the most important issue for any public administration. Additionally, investing in health resources is cheaper than devoting resources to diagnose, cure, or give intensive care treatment to people affected by any avoidable and preventable disease. The second lesson is about education. Before the world was in lockdown, nobody was imagining a situation like this. The schools were open, and students were normally attending school in person, and from one day to other, everyone was sent home. The schools, as most of all other places, were closed, and the students and the teachers need to create new ways to follow the learning process. But neither the students nor the teachers were, in the most of the case, prepared to use technologies which gave them the possibility to interact as if they were in a normal classroom. COVID-19 has been one of the biggest challenges that education system ever faced. Distance education solutions have become the mandatory choice of countries to maintain educational process in this period. Concurrently, the long-term impact on distant education on educational outputs and suggestions toward minimizing the negative effects have begun to be discussed. Predictions on the potential increase in educational inequalities after COVID-19 pandemic has become prominent in this discussion. After the pandemic, it is predicted that transitions toward digital education platform will be accelerated, and revision of the educational processes based on the new skills demanded by labor market will be critical. The importance of remedial education is a must against permanent effects of inequalities in opportunity, particularly in disadvantaged schools, especially with people from rural areas with poor access to technology and no tools to be connected and no training to know how to do it. Just imagine situations in some part of the world where the Wi-Fi signal was very difficult to reach, or where the possibility to have any kind of internet connection was remote. The situation created two new categories of people, especially on the most vulnerable population. Those who have the minimum resources to connect via internet to the schools who were able to provide such services, and those who did not have the resources to be connected and they could not follow in any school program. At this difficult time, we were also learning of very inspiring and motivational experiences. For example, in Ecuador, there was a teacher, Carolina, who traveled every day by bicycle carrying her blackboard for more than 20 kilometers to reach students in rural areas. She never received payment to do this. It was only because she felt that it was her duty to go and teach these children in these uncertain times. The third lesson is about the third age population. I believe that all of you agree with me about the most affected population since the beginning of the pandemic has been seniors. We cannot accept this as a society. That those who gave us the effort and hard work, the quality of life that we are enjoying today in our developed countries, suffer the abandon and the loneliness of such a situation. We need to, not only as a scientist, but as a society, to avoid the repetition of such a devastating problem. Post-COVID-19 recovery strategies need to focus on building back fairer cities and communities, and that this requires a strong embedding of age-friendly principles to support marginalized groups of older people, especially those living in deprived urban neighborhoods trapped in poor quality housing. It shows that older people living in such areas are likely to experience a double lockdown because of restrictions imposed by social distancing combined with the intensification of social and spatial inequalities, including disproportionate impact of COVID-19 on older people, highlighted how the pandemic has created both new and reinforced existing inequalities in aging along the lines of gender, class, ethnicity, race, etc. Second, the pandemic is having a disproportionate impact on deprived urban areas already affected by cuts to public services, to loss the social infrastructure and pressures of the voluntary sector. And finally, the interrelated social inequalities at both the individual and spatial level are affecting the lives of older people living in deprived urban neighborhoods. The fourth and last lesson is about research. During this pandemic time, it was absolutely clear that if a country does not invest in research, they will need to pay much more money for the research developed by others. 24 months ago, not one scientist nor the general population could ever have imagined that in case of an emergency, we could be ready in less than 1 year with more than 10 vaccines prepared to save lives and to avoid thousands of deaths. As all of you perfectly know, in a normal process, it takes more than 10 years to have vaccine readiness. But thanks to basic research behind these products, which have been made mostly by private companies, the scientists have been able to produce it in a record time. And because the European Commission in Europe and the FDA and other agencies in the USA decided to back the plan with billions of dollars or euros to accelerate the process. In my opinion, this factor is a turning point, a real milestone in the history of science that needs to be highlighted. Let's go in deep and analyze this topic because probably this is one of the main achievements that we, as humans, have been able to accomplish to resolve a problem like the pandemic. The answer to the problem has been vaccines. As of 7th of November of 2021, 7.25 billion doses of COVID-19 vaccines has been administered worldwide based on official report from national public health agencies. AstraZeneca anticipates producing 3 billion doses in 2021, Pfizer-BioNTech 2.5 billion doses, and Sputnik, Sinopharm, Sinovac, and Janssen 1 billion doses each. Moderna targets producing 600 million doses and Covidacia 500 million doses in 2021. By December 2020, more than 10 billion vaccine doses had been pre-ordered by countries, with about half of the doses purchased by high-income countries, comprising of 14% of the world's population. Prior to COVID-19, a vaccine for infectious disease had never been produced in less than several years, and no vaccine exists for preventing a coronavirus infection in humans. However, vaccines has been produced against several animals' disease caused by coronaviruses, including the 1003 infectious bronchitis virus in birds, canine coronavirus, and feline coronavirus. Previous projects to develop vaccine for viruses in the family Coronaviridae that affect humans have been aimed at severe acute respiratory syndromes, the SARS syndrome, and Middle East respiratory syndrome, the MERS syndrome. Vaccines against SARS and MERS has been tested in non-human animals. According to studies published in 2005 and 2006, the identification and development of novel vaccines and medicines to treat SARS was a priority for governments and public health agencies around the world at that time. There is no cure or protective vaccine proven to be safe and effective against SARS in humans, and also there is no proven vaccines against MERS. But vaccines that use an inactive or weakened virus that has been grown in eggs typically take more than a decade to develop. In contrast, mRNA is a molecule that can be made quickly, and research on mRNA to fight diseases was begun decades before the COVID-19 pandemic by scientists led by one of the most respected Hungarian scientists today, Dr. Katalin Karikó, who works at the Perelman School of Medicine at the University of Pennsylvania and also served as a vice president of BioNTech. Her research has been the development of in vitro transcribed mRNA for protein therapies, and hopefully soon, I hope, she will increase the list of Hungarian scientists awarded with a Nobel Prize for such outstanding discovery, as she and her colleague, Drew Weissman, received this year the prestigious Lasker Prize, considered the pre-Nobel Award. As multiple COVID-19 vaccines, more than 10 till now, has been authorized or licensed for use. Real-world vaccine effectiveness is now being assessed using case control and observational studies. These facts, ladies and gentlemen, are the real power of science, the capacity to research and then save lives. I end my speech today reflecting on the future of the science in this new era. I, as many others, feel serious concern in the face of the degradation of the working conditions of researchers, especially the youngest of them. The race toward ever greater competitiveness and short-term profitability, the foundation of our current societies, leads to inhibiting the creativity of researchers and their capacity for innovation. This policy, which advocates excessive profitability, paradoxically goes against the objective portion. I am aware that given the advances of knowledge and technology, the conditions for the exercise of the research profession have changed profoundly and will change again even more radically. The period after the Second World War was marked by an almost exponential growth in the number of researchers. The large material and human resources used limit the freedom of initiative of researchers. They spend more and more time looking for credits, which also require the establishment of an inclusive restrictive administration issue. Although it is essential to adopt the modes of organization of research to this permanent evolution, at present we are witnessing an avalanche that leads to the sacrifice of some of the fundamental values of research. This point is based on the conviction, as Dr. Pierre Joliot-Curie says, that research is a form of artistic activity that relies on creativity combined with a high degree of technical competence. The goal of any research activity is to lead to discover in the minds of the public and many researchers, the discovery remains an exceptional act capable of inducing what philosophers call an epistemological break. These discoveries have always represented exceptional events, even during the life of the greatest creators. Currently, due to advances in knowledge and the number of active researchers, the probability that any of them is the author of such a discovery is extremely low. Should we conclude that there is nothing more to discover? The history of science shows us that interpretation and theories that appears to be more solid found and must be re-evaluated, refined, and exceptionally reversed. We observe that any advance in knowledge generates as many new questions as its answers. Therefore, I'm convinced that today's researchers have almost limitless fields of research before them that should allow them to express their creativity. They have yet to accept that in most cases, those scientific advances will only affect limited areas of knowledge. It seems to me essential to convince young researchers that the creative process can and should be practiced at the very different levels and does not concern exclusively a very limited band of exceptional individuals. I hope that these modest thoughts and reflections about science and its power have been sufficient to motivate and inspire those in the audience to work harder to achieve their main goals of scientists, which is to improve the quality and quantity of life of the humankind. Thank you very much.